Hello guys, welcome back to my main channel. If you haven't already, you should hit subscribe and like and comment on this video. But other than that, let's get started. I want to talk about something that is affecting us all in this day and age right now, and that is the coronavirus, which started back in 2019 before the New Year's. I think that it's really important to know what we're dealing with, especially since a lot of us, including myself, we have to stay in sheltered and in quarantine, as well as a lot of businesses near us. They might liquidate or go bankrupt due to the increase in the unemployment rate each day because the cases of coronavirus increase each day. And I think that it's really important to know what we're dealing with and what symptoms it shows and try to find the best ways to prevent it. A lot of us might not know what the coronavirus is, so today I'm going to tell you, what does the coronavirus even mean? The coronavirus is defined as a new virus which can cause an infectious disease and respiratory illness. Even though the coronavirus, also known as COVID-19, is a new virus, there are also other viruses that are genetically related to it. They may have some differences, but they are similar in many ways. Here are the 3 viruses that are commonly related to COVID-19. These viruses are all similar to each other. They all affect the respiratory system. SARS, which is severe acute respiratory syndrome. Then MERS, which is Middle East Respiratory Syndrome, and then the cold, which is our common cold virus. This is a family of viruses. They all have a lot of similarities together, especially the symptoms on their host. Similarities in symptoms are dry cough, fever, body aches or muscle aches, shortness of breath, sore throat, runny nose, and fatigue. These viruses are similarly related to each other, especially SARS and COVID-19. SARS, which is severe acute respiratory syndrome, appeared back in 2002 in China, and it spread worldwide within just a few months, but it was indeed quickly contained. Since SARS and COVID-19 are very similar to each other, another nickname for coronavirus is also SARS-CoV-2, which is coronavirus number 2. Well, now that you have learned some information about viruses that are similar to the coronavirus, now we should get started on how does it even work on the human body. Well, viruses have spent billions of years perfecting the art of surviving without living. What? What does that even mean? Well, there is not an exact answer to that question, but the life of a virus. Technically, viruses are not alive, but that depends on what type of virus it is and the conditions of the environment it is in, as well as the type of surface it is on. Once the virus finds its living host, it'll enter the human airways and it'll basically hijack our cells, which will cause it to create millions and millions of versions of itself. The coronavirus is known to be a type of respiratory virus. It tends to infect and replicate in 2 different places, in the nose and in the throat, where it's highly to be contagious, or the lower part of your lungs, where it doesn't spread easily, but it's much more deadly for the victim. Before its host shows symptoms, it is already spreading its replicas everywhere. Symptoms are shown about 2 to 14 days of exposure, but is likely you might not even show symptoms. It is powerfully deadly in some, but mild enough in others to escape containment. It is also perilous for anyone who is above the age of 50, and chances of it being even a higher risk are those who are even older, especially for anyone who is 80 and above. It is also speculated of those who have pre-existing conditions such as chronic diseases, as cancer or diabetes. Some examples of pre-existing conditions that could be deadly for those who have the coronavirus are the people with health issues in the circulatory system, Examples are heart disease, diabetes, respiratory diseases such as bronchitis, and hypertension, which is abnormal high blood pressure. I'm going to go in a little bit more depth of how the virus works and how it spreads in your body. When the virus enters the cell body, releasing RNA, virus RNA invades the cell's nucleus and takes over. Bam. Viral RNA uses the host cell to create new RNA and assembles more viral particles. Then, new viral particles are released and sometimes destroying the cells in the process. So, for our solution, if you ever touch an object such as your phone or a doorknob, you are basically getting germs spreaded on your skin, or in this case, the virus. So, for our example here, I have just put germs all over my body. So in order to prevent this, I'm going to use just a tiny bit of soap. See what will happen when I put just a tiny bit. It spreads out, which proves my point that you should at least wash your hands for 20 to 30 seconds. And you can use other products such as hand sanitizers that contain at least 60% of alcohol. But the number one thing you should do is always to wash your hands. In the short amount of time, there has been over 200,000 cases, and it's increasing each day. Unfortunately, medical services have to choose between the people who get treated and if they're highly at risk. If you are not one of those people who didn't receive the medical attention they need or is trying to take care of themselves or their families, then make sure to follow these guidelines. Therefore, if you are showing symptoms, you should gargle salt water if you have a sore throat, or eat garlic or ginger. Also, you can mix honey with tea like I do. Also, you can get a steam inhalation to open up your airways or use a mechanical generator to move air in and out of your lungs. And best ways to get these items without having to leave your home is through Amazon, which is the best source for now. And the best ways to strengthen your immune system is try to limit the amount of sugars and carbs drastically. Also, anyone with diabetes or keeps insulin, make sure to keep insulin spikes low as possible. Also, fill your body with foods such as cheese, avocado, eggs, yogurt, olives, instead of foods that contain glucose. One last thing before I end this video. Since we are all in quarantine and some people have an obligation to provide their families with food and hygiene products, it is for the safety of our nation that we should not be hoarding products without considering the feelings and conditions of other people who don't have any. In order for us to get out of this economic calamity, we must avail each other. As long as we are patient and follow guidelines, we can proceed forward from this and make the best use of our time at home. I hope you and your family stay safe out there, and I hope the best for our future. Thank you for watching this video.